All right, thanks, Paul. Yes. All right, looks like we're good. We are being recorded right now. Dr. Warner, you were able to call the meeting to order.
All right. Well, thank you for being here tonight. I'm going to call the September 10th, 2020 meeting of the Skokie Board of Health to order. And before we proceed, I need to make a statement. Upon further notice, or until further notice, meetings of the Board of Health will be held electronically, with the majority of members participating via remote access in order to comply with the State of Illinois gubernatorial disaster proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Bruce A. Jones with the Skokie Health Department, and all properly submitted statements and questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by email to citizen comments at Skokie.org, Skokie.org, or mail to the Village of Skokie, to the attention of Bruce A. Jones, Interim Director of Health, 5127 Oakland Street, Chicago, 00077, or via the Village's Dropbox located by the public entry to the village. And so far, Bruce, we've not had any public comments or questions, have we?
No, we have not. I have a computer in the room that I will be checking later as we get to the citizens' comments portion of the agenda. If there are any, I will read those into the record.
And that portion is toward the end of the agenda, so we may have some questions coming through. Well, I want to welcome everybody. This is a break in the world that we're in now, and as we become accustomed to these new technologies, they seem to work remarkably well, and I'm so glad you're all here tonight. As we said a little earlier, if you could put your mics on mute, I think it'll help the meeting proceed. We do want to have an open discussion, though, so if you wish to ask a question to be heard, you can wave. You can also go to the chat room. And Bruce, can we periodically monitor the chat room as well?
I can, yes.
Yeah, okay. So, be patient with us. This is all new technology, and you probably all have had an experience of some of the challenges of connecting with family and friends or working remotely. So, I'm confident that we're all very savvy and we can get this figured out and we can have a good meeting tonight. So, with that, I'm going to ask for we'll change how we have been conducting business. Instead of going through a lengthy review of the agenda and the previous minutes, I'd like to adopt what's called a consensus approach. So unless there is some item that you wish to extract from the agenda or from minutes and bring it up for discussion, otherwise the agenda and the minutes will stand approved as published. Is that understood by everybody?
Yes.
This is acceptable parliamentary procedure. Many organizations utilize this. And so I think in the interest of being efficient, this is a good way to approach our meeting tonight. Also now, I think probably the bulk of our meeting is going to be around what's going on with the village's response to the COVID crisis. And with that, I'd like to introduce, well, first of all, does everybody know Bruce Jones, who's the interim director? And Sue Reesberg is a public health nurse and is going to be covering the village's response to COVID. So I'll ask Sue now to lead us in that.
Good evening, everyone, and this is my smiling face, and this is not. So, many of you I know, Mike Vernon, thank you for being here. Mike has been a great help to us at various points at Illinois Department of Public Health. Thank you very much. I'd like to also recognize that Dr. Warner, in the earlier stages of the pandemic, was coming in and assisting us to do contact tracing. So thank you, Dr. Warner. It's gotten more complex, and we have some contact tracers. So let me tell you where a brief history. I'm sure there will be many questions. We started our response end of February, beginning of March. We have been open 7 days a week.
Mr. Usman, can you mute your mic?
Mr. Usman, can you mute your microphone?
Okay, the volume on the computer.
Okay, thank you. So we have been, here 6 to 7 days a week, mainly 7 days a week, doing contact tracing. We did receive a grant. Some technical difficulties. Just a moment. Can't hear me?
I apologize. Okay.
So we received a grant from the state for over $800,000, which has allowed us to hire, we right now have 2 full-time contact tracers, one of whom is a Spanish speaker. We hired a part-time Urdu, Hindi speaker. I have, starting next week, a full-time speaker who speaks, a tracer who speaks Russian and Arabic. We have hired 2 social workers who've been invaluable to us to help with needs other than COVID that people are experiencing. This all started in the Skokie area after a group met in Washington, D.C. with over 25,000 people, and those were our very first cases. They came back from this particular meeting, and those were our very first cases. So we started end of February is when our first cases came in. Our positivity rates, and you can go on the website, they're updated frequently. We are lower than suburban Cook County. Suburban Cook County is about 6%. We are lower. Our contact tracers and the nurses, we also hired a full-time nurse as well to assist me with a number of the groups that are continually calling. We hear from businesses, we hear from long-term care facilities, which, Mike, are doing much, much better. Thank you. We are now hearing from the schools who are opening. So we're hearing from school staff and school nurses multiple times a day to help solve issues that they have. And what do I want? We are averaging anywhere. Today was a low day. We had 3 cases. We've had up to 15 or 20 per day, but that's not our average. Our average is about 8 to 12 per day that we are following. And what else do I want? I mean, it's 24/7. COVID is what we're doing. We are, right now, as I say, the schools are opening. We have 12 public schools and about 7 or 8, and this is not including the high schools, 7 private schools, all in some form of opening. We hear from their superintendents, their principals, and their school nurses daily for advice. So that's our peak right now is the schools, is what we're hearing from. I should have more to say, but I'm sure you're going to have lots of questions for me. So, as I say, we receive daily cases through our electronic surveillance system, INEDS. We remove those cases. The cases are contacted. We attempt to contact their contacts. We try and find out where they have been. We also get calls from businesses for assistance. We've been getting calls from businesses who are really good in calling us to tell us we've got one case, what do we do? Bruce's team will go out. They also consult with us to try and put out those fires so that they don't spread. And we are obviously going with the advice from the Illinois Department of Public Health and the CDC. That is the information that we are passing along. And we are educating every person that we call with contact tracing. It's not just finding out and telling them that they have a positive case, but it's educating them about what is isolation, what is quarantine, Do you need any help during this period of time? Educating them about the disease, when to call their provider should the disease progress. And most of them are very cooperative, most of them, and they're very grateful for the education that we're providing. Questions?
I just wanted to comment, when I helped out with contact tracing earlier this year, if you want to see your tax dollars in action, come down to the health department sometime, not during this emergency, but it's very impressive the work that the staff is doing. And so, Sue, would you really thank the staff for all of us in
Yes.
terms of the great job that they're doing?
I will. I will.
The other thing, if you had a chance to check the daily release of the statistics, it's really quite remarkable to watch that. And you can get a daily update. It's now during the Monday through Friday, but it gives you an idea where the village is going. And as Sue said, that there are some blips that occur. I suspect some of that might have to do with batching that occurs with testing.
Some batching that occurs with testing, some 2 weeks post-holiday, so after the 4th of July, and I expect we will see, it was after Mother's Day, actually, we saw a bump. We saw some after the 4th of July, and we just had Labor Day weekend, so let's see what happens 2 weeks out from the 8th.
And is it correct that there's been an increase in the number of younger people
Yes,
reporting positive?
yes, we are skewing younger. We are still seeing middle-aged and elderly skewing younger. The other thing, when I'm talking about schools, I'm also talking about college students. We are getting reports, and they're reported to us because their home address is Skokie. But then we look to see where the test was done. The test was done in DeKalb, or the test was done in Peoria. So we have a pretty good idea that they are in school. We contact student health to find out if the schools are doing testing or if the students are going somewhere else private, unlike the University of Illinois in Champaign. And we contact the local health departments to alert them that these students are there because they shouldn't be alone in dorms with COVID. So yes, we are now seeing college students. Prior to that, we were seeing a rise in the younger population anyway, but now we are seeing quite a few college students.
Thank you. Other folks, I see Heidi unmute and ask your question or concern.
I just wanted to say thank you. I am getting those texts daily and have been now for months. And I always hit the webpage when my text comes in to remind me that that's been updated. I really appreciate that level of transparency. I think that's really important. And I've appreciated the visual data visualizations that you also put out. I think that is really important in telling the story of how our loneliness is what we look like over time. So thank you so much to
You're welcome. Thank you for your comments.
I have a question. I'm sorry I joined late, and Sue, I do not know if you discussed the possible scams that are going on with contact tracing. Did that come up?
With some of our so again, and I backed off from some of the tracing during the week because I'm handling other fires, but I'm in constant contact with them. I don't know how counties do this remotely, Mike. I really don't, but we need to talk to each other all the time. Some of them are wary of us and leery of us. There's also a computer program called Salesforce that we're using. And so you can plug a headset into your computer and make a phone call directly from there. Initially, we didn't know who the heck the phone call said it was coming from. It may have said Department of Public Health. Well, people don't want to answer that because they don't trust it. If they see the Skokie Health Department, they're more likely to answer. We've had a few people refusing and thinking it was a scam, but the majority, no. Some people just don't want to be bothered at this point because I'll be honest, many people are getting tired of this. And so we've also had those kind of responses. They just don't want to talk to us. They know what's going on and they don't want to deal with a government agency. And I've got some really good tracers who can kind of talk their way around that and get these folks to talk and give them information. But not so much with scams at this point.
Well, the thing that I was getting, I just heard a part of a web seminar on that, and they were talking from the public health side, and they were talking about how the scammers were using it as an opportunity to gain personal PPI, personal protected information from the person that called. And sometimes the people are very willing to give it up, thinking that they've been, exposed to COVID, and they, so they're willing to try to ameliorate any of those problems. And I think maybe the health department, if the word has gone out for people, we're not going to contact you and ask for personal information. And if someone is asking for that, that's not the Skokie Health Department. I'm assuming that would be true and safe.
Mike, I think that was going on one of the webinars I was on from IDPH. They were talking about that, as well as a large public campaign to talk about contact tracing. Our tracers, one of the first things they say when they get on the phone, certainly they want to ask a few pieces of information, like your name and your birth date, or your name and your address, to say, I'm calling to verify that's who I'm talking to. And the next thing is to say that your personal information will not be disclosed, and we are not asking for reams of personal information like credit card data or anything like this. This is only used to talk to you about the illness and to educate you about how you can keep yourself safe and your community and your family.
Well, thank you.
Sure.
Like, a great job.
Yeah, that is correct, Sue. You described that really well. And for those of you who don't know me, I just wanted to let you know that I had reported to this group at one of the meetings that I was going to be retiring, and I did, from North Shore, but I came out of retirement earlier this year, and I'm currently working for the state of Illinois. Actually, I work with Dr. Khan on a very close basis. You could say she's my boss because she is the medical director for health protection. So we are on conference calls and we phone each other almost every day. She is aware of the great work that's being done in Skokie, of course, as she knows that this meeting is going on tonight. And I just wanted to let you know, Sue, you and your team, I am your point of contact for the state, for the entire suburban Cook County region. And I've spoken to you, and I've also been in contact with Claudia.
Yes.
If you have any questions regarding COVID-related issues with any city, please feel free to reach out to me if I can provide some answers or provide you with resources.
Thank you, Mike. We have and we will continue to do so.
Thanks.
Yeah, thank you, Mike. Sue, could you also comment with the students we've had from the UIC School of Public Health?
Yes, we had some absolutely phenomenal students from the USC School of Public Health who, before the pandemic, contacted us, and they all had their wonderful little projects that they were going to do. Those all changed. They took on large projects for us. Elliot Weiss took on data collection and entry with David Clough, our data analyst, and he rose to the occasion, and he really, he took over for a week. Dave had scheduled some time off. Elliot handled it beautifully, so that it was seamless. The data was being entered, positivity rates were there. You never would have known that David was not there. J.C. Wasoski was assisting me in handling nursing home outbreaks, long-term care facility outbreaks, which, as I said at the beginning of the outbreak, were an issue. Mike, I'm proud to say that most of our facilities, if not all of them, have not had any resident outbreaks in over 28 days, well over 28 days. Yes, and they do have asymptomatic staff. That's the issue right now. And Elizabeth Meininger assisted me with, and Bruce's team, with the outbreaks in businesses. She helped keep track of those, and helped us to keep on task with those. So they were absolutely phenomenal students who fit right in with staff. They also were doing contact tracing as we needed them to do, because they were on board before I was able, we received the grant, and I was able to hire contact tracers. And actually, after we received the grant, we were able to pay the students as well. So they were wonderful. One of them is continuing with us 1 day a week on Mondays, which is great because that might be a heavier day for us. So they were absolutely phenomenal, and they were able to change gears and change course immediately. They were of great help. Thanks, Dr. Werner.
And it's a great experience for the students as well. I remember
Yes.
when I was in epidemiology and we got to contact tracing, it was either who got sick from eating potato salad that's out for 5 hours in the sun at a Sunday school picnic, or venereal disease. We never talked about pandemic that I can recall. So this was a wonderful opportunity for those students.
Well, this is an unbelievable time to be in school in public health, and they had a real boots on the ground experience that most of their colleagues did not get. In fact, one of them is now a contact tracer because they're back in school at UIC School of Public Health. One of them is a contact tracer at UIC. So we're very proud of them.
Heidi has it.
Heidi, what's the question?
Thank you so much. I don't know if this is for Sue or for Mike. Sue, you mentioned using the CRM, I think you said Salesforce,
Yes.
for the kind of tracking and mapping your contact tracing. Is that something that Skokie was out ahead of doing, or is it, is this a state endeavor or a county endeavor?
Could you maybe
I
repeat the
want you
question?
guys to share that information.
So I'm going to try and paraphrase the information in case people couldn't hear because I'm having a little trouble hearing. You asked about Salesforce and if this is a local initiative or if it is a statewide initiative. There was a system prior to it, which Mike, you know, RedCap, which was a disaster for this anyway. Salesforce is a platform. It's a computer platform. They design computer programs. They're based in San Francisco, but they have offices here. And so they developed a program for contact tracing. We were the second wave. Lake County was the first, and there was one other department, Mike, that were the first ones to utilize Salesforce. They were rolling it out on a test basis. We were in group number 2, and then on the 4th of July weekend, yes, it didn't work because no one was there. Anyway, we were in rollout number 2. There have been 4 rollouts. The program is continuing to be developed and refined because remember, it's computer programmers, not people in public health, that are programming this large system. And so we are continually giving them feedback so that they can refine the program so it works better for public health. So this is a statewide, yes, for us to keep track of. In our case, we can see our Skokie cases. We are able to monitor them through daily health assessments. They can actually complete a daily health assessment. If they do not, we see that, and our tracers call them to find out what's going on and how they are. And so, yes, this is a statewide program. We see our cases. We can link our contacts. Many times those contacts are in other jurisdictions. So we can link that. We can see if other jurisdictions have seen those cases yet. We are putting them in. So yes, it is a statewide database that is continually being refined so that we can add information. And we'll be able to mine that data for all kinds of things to learn about this illness. You're welcome.
Any other questions? If not, I think, Sue, this will probably be a standing item on our agenda going forward for a while.
I'm sure.
And vaccinations for COVID. But before we get there, do you want to talk about what's going to happen this year with the flu clinic?
Yes, I was going to get there. So, do not be afraid. We are having 2 large flu clinics. However, they're being done in a way we've not done them before. You know we've done them, they will be at Oakton Park, September 30th, Wednesday, September 30th, and Tuesday, October 6th. They will be, instead of 4 hours, they will be 9 hours. In 4 hours, we can do 1,000 people. In 9 hours, we will do 900 people. We will do 100 people per hour. We have a limit of 50 people in a room. We are doing this according to state guidelines. And so people can't come before their appointments. People can't walk in. You must come by appointment with your mask on. You cannot be ill. So there will be far fewer people. I have many volunteers from Oakton Community College, young people helping us. And I've reduced the number of vaccinators. We will have 2 rooms, and we will have 3 vaccinators with 3 assistants, as opposed to having a room with 12 to 15 to 18 vaccinators. So we hope to be able to move the people through efficiently. So people will be socially distanced, and as I say, it will be spread out over the course of 9 hours. Please don't talk to me on October 1st. So that is how we plan it. We will see how it goes. We've been over to Oakton Park twice already. We're going to go there again. We're trying to make sure that, we can do everything that we can think of for safety prior to the clinics. Will there be some hiccups? Maybe, but we'll deal with them. So that's what we're doing for flu clinics this year. It may be a model later for a COVID vaccine. I don't know.
I can tell you, Sue and the rest of the committee, that we are actively working on mass COVID vaccine distribution plan for the entire state. Actually, when Dr. Khan came on board, she asked me if I would serve on that working group to provide guidance for vaccine integrity and all of the infection control guidance that goes along with vaccine storage, transportation, making sure that it's kept at the right temperature. All of these things are being addressed. We don't have a COVID vaccine as yet, but if and when that time comes, all of the planning is in place to make sure that there is a wide-scale distribution plan. Very similar to the model that we used for the H1N1 vaccine in 2009, but there were some hiccups, as Sue will recall, with that vaccine distribution plan. So we're aware of those, and we're trying to address those in a timely manner. The other thing I wanted to mention to this group is that Halloween is fast approaching, and we had a call yesterday to discuss whether or not we should recommend canceling Halloween, which I would be in favor of. But we pulled back from that because we recognize that even if we said cancel Halloween for this year, people will still do it. There will still be trick-or-treaters, and people will have private Halloween parties and gatherings. So we decided instead that we would provide some safety guidance, which will be coming out. And of course, the Skokie Health Department will be receiving this guidance for distribution to communities in this region. And the other thing I wanted to mention also is the point of care testing. There are these rapid antigen tests that have been shipped by the federal government to long-term care facilities. So I'm not aware of, I don't know if any of your long-term care facilities are actively using these tests.
They haven't contacted me about that.
Okay, so this is something that has to be closely monitored in terms of how this test is being applied as a diagnostic tool or as a screening tool. And there's also a reporting requirement that the facilities that are performing the tests have to report their test results to the state.
Okay.
This
the long-term care facilities will be reporting it in INEDs?
Correct.
Oh, I don't even know if they're set up to do that, yeah.
That is my point, and I am very concerned about this, just bringing it to your attention that if they fall, you could always reach out to me, and I will try to walk them through
Okay,
the process for how they can sign up and report their test results.
okay,
Be aware also that these rapid point-of-care tests will also be distributed to schools. So that is something that you should also be aware of. Who in the school will perform the test and how will they report it?
An issue, if and when we do get a COVID vaccine, I understand there may be an issue with what's called cold chain, with the storage,
Yes.
distribution.
Yes.
And big facilities will be able, especially if it has to be stored at a very cold temperature, will that be an issue?
Sub-zero, it will be a challenge, Bill. That is something that we're very mindful of, and we have to make allowances for this. Also, there is an expectation that this will not be administered as one shot, so it will be two.
Hey, Paul.
And there's talk about it being spaced 3 weeks apart. So there will be some challenges.
I believe so. I'm trying to walk up there. I don't know where the speaker is coming from.
All right, is there any other discussion? Is there anything in the chat room that we need to address?
let me ask Bruce. Chat room. He is checking. I think we're experiencing some
Let
technical
me see if I can turn up the volume on this.
here.
Yeah. Keep going, all the way up.
Aren't we at 100?
Yeah, no, there, it's up upper left, okay.
Oh, okay.
Okay, Paul, the speaker on the camera is up at 100, and where should we put it? Where should we put it for the computer? So the computer is at 100. Can you see that on the screen? Mm-hmm.
Excuse me.
Let me see. Sue, why don't you step back for a second? Is the group having difficulty hearing each other on Zoom?
No.
No.
Good.
Audio is great.
Okay.
We can hear very well.
Okay, now I've got it turned up. Okay. Okay, hold on one second, Paul. I apologize. Can each of you speak just a quick few sentences or a few words? Say hello.
Hi, it's Michelle Bromberg. Can you hear me?
Hi, Nabasi.
That's Mr. Bossi.
Good evening, Mr. Romel. Good evening, it's Ed Lynn.
Michelle Bromberg.
The other people are coming through the speaker on the microphone. Really well.
Hi.
Okay. All right.
Hi, this is Ruth Worma. Do you hear me?
Yep.
Okay, thanks.
Yes.
All right, thanks, Paul.
Bon Shem.
All right. Bye.
Mickey Drackler.
We're good. Just speak towards them.
Okay, I think we can hear everyone. Are there other questions, or Mike, do you have more information for me? So you have more work for me. You always have more work for me. Okay.
Well, I put a question in the chat. I'm not sure about antigen testing, honestly, but point of care testing could be really useful in the dental clinic environment. And can you speak to that, Mike, or anybody?
I'm not aware of any plan from the state to distribute the point-of-care testing to dentistry. Of course, you can always purchase these test kits independently and use them according to the manufacturer's instructions.
But a lot of them stink.
They do. You know, and the sensitivity is not that great. So,
Right.
you know, what I'm in favor of is using them as a diagnostic tool to test symptomatic individuals. Because if you get a positive with the antigen test, we consider that a probable case and we treat it as such. However, the problem is if you get a negative, you are required to confirm that negative with a PCR test, which is the more, that's the gold standard test
Right.
for COVID-19. So, you know, if you do screening in a long-term care facility, for example, and you identify 2 cases and 98 of those individuals, if you have a population of 100, test negative, you would have to repeat 98 tests by the PCR methodology, which is time-consuming and costly. However, you've identified 2 positives. So there's a cost-benefit analysis to all of this. But, you know, this was taken out of our hands, and the federal government decided to distribute these test kits, the point-of-care testing, to all of the long-term care facilities in the entire nation. And there are plans to distribute them to schools as well.
So Mike, can I just clarify? The point of care testing has to be validated by a PCR?
The negatives.
The negative.
I can send you, I have the guidance, Sue, which I can send you.
Would you share that?
Oh,
If
absolutely.
it's shareable, that would be wonderful.
I can send it share it with the entire group so that you see what
Thank
is the
you.
guidance for performing the test, and there's a flow chart also for how it should be interpreted. So I will send those along. I'll send them to Bruce, and he can distribute it to everyone.
Thank you.
Thank you.
Larry, you had a comment? You have to unmic yourself. You have to unmute yourself, Larry.
It is. Okay, I'm unmuted. Sorry. Yeah, Heidi, I was going to let you know that one of the FQHCs that I deal with, I'm on their board, they purchased the point of care testing, the Abbott one that came out that was the 5-minute test. They purchased that for the medical side, and I made the recommendation to them that they should also have it or share it with the dental side. So they're doing that now and making sure that the patients, you know, it's just an extra screening tool. It's not really to diagnose COVID, but it's to rule out people that are symptomatic as such or have something in the blood that goes along with it. So whether there's some fault with the test or not, they seem to be working nice, and they are using them at a couple of actually 4 of the clinics here in the local area.
Thank you.
All right, are we ready to move on to the next agenda item? That is the chair's report. I know that was always a highlight with Dr. Drackler, so hopefully I can follow in that tradition. But there have been several changes with the board. Of course, Dr. Kennard has resigned and is working with IDPH, as Mike has talked about. And Dr. Drackler, I'm so glad you're here as emeritus member. Your many years of service are much appreciated, and your leadership. We have some new members. And I'm not sure if any of them are with us this evening, but Maureen Hallen is a nurse attorney. Sybil Yao, and Sybil's here. She is a nurse. Margaret Keller is a physician assistant in primary care. And Dr. Edward Lynn is an obstetrician gynecologist joining us for the first time. Welcome, Ed. We've had 2 resignations, Jessica Jones and Dr. Timothy Yakahana. And one other change in terms of just the department arrangements, Human Services Division is now part of the Health Department. That is led by Beth Lindley. And again, from the brief time that I spent in the health department, it was great to meet with Beth, and she and her people have been providing services that are sorely needed during this whole COVID epidemic in terms of social services. So any questions for my report? I'm trying to keep it brief so we get through this agenda. Dr. Kennard had distributed several of her reports to the trustees, and we sent it out under a cover letter earlier. So hopefully you've received her reports to the trustees February through June. And I'm not going to take the time to go through each item by item, but I would recommend that you review those because they will bring you up to date on what's been happening with the health department. And is there a director's report? Bruce, do you have anything to report?
I do, actually. I apologize. It just was being finished as shortly before the meeting, so I apologize I couldn't send it out. I will get it sent out first thing tomorrow morning. Would you like me to read it for the group? Okay.
Yeah, go ahead.
Highlights?
The highlights, sure. Well, as Dr. Werner mentioned, Dr. Kennard moves on. She took the position with the Illinois Department of Public Health after serving the village of Skokie for 11 years. Her last day was with us was August 14th. We thanked her all for her great leadership and wished her well as she begins her new chapter as the medical director in the Office of Health Protection. I am serving as the interim director. We also have Dr. Bruce Doblin, who's an MD and a Master's of Public Health. He will serve as the village's medical consultant as the search for the director of health is pursued. Sue covered our community flu shot programs pretty well, so I won't repeat that. Ongoing projects that we have right now, planning of a Skokie Community Foundation Health Symposium. Beth Lindley and David Clough met with a team of providers to plan a health symposium for healthcare and nonprofit providers through the months of July and August. The first program actually was held just yesterday, September 9th, via Zoom, and it was a very good event. Our COVID-19 response, Sue again gave a great detailed report on that with our contact tracers working diligently and contacting more than 90% of our confirmed cases within 24 hours. And as she mentioned, our cases are also skewing to the younger people as is being seen around Cook County and throughout the region. Skokie Community Foundation Flex Fund Grant on August 9th, 2020. The Skokie Community Foundation wrapped up their fundraising campaign with a total of a little over $58,000 raised to support Skokie families negatively impacted by the COVID-19. During the month of August, 14 families received support through this grant process. We also have additional CDBG COVID-19 funding coming through. This funding will provide rent and mortgage utility assistance to Skokie residents negatively impacted by COVID-19. Connections for the Homeless will serve as the banker for these funds, and Human Services staff will work with them to coordinate applications up to $2,500 per household. Human Services staff have met with the Connections team on several occasions to plan the application process. And then last, Beth Lindley met with the Teen Library Council to say thank you for their support of a well-being call program over the summer months and discuss the census with them. She reviewed why the census is important and encouraged families to discuss about completing the census. And that concludes my report. If anybody has any questions.
Seeing none, then we'll get to old business. Does anybody have old business to raise? Seeing none. New business?
Well, this is Abasi, and I'd like to know, are we doing anything about flavor, whipping, being in Skokie, like we Chicago made it 46 to 4 vote? Are we considering anything?
So I just heard that on the news this morning. That would be something that obviously the board, since the board has always been a great champion against smoking and vaping. That's something that the board I could meet with Dr. Werner with if someone wants to make a motion to put something in start the process to submit that to the attention of the mayor and the board of trustees.
I'd like to make a motion to Skokie Board of Health present to the Board of Trustees, considering the flavor vaping in Skokie could be banned, like other states doing it.
All right, that motion's in order. Is there a second?
I would second. This is Heidi Nickish-Duggan.
Okay. Is there any discussion?
Well, we discussion, everybody know what the consequences are. We bang around, so I would say, let's give it to the board, and they always look into it. We have all the information we needed. The only thing is when we want to initiate this process, so we can protect our residents and our environment. So if anybody want to add anything, I'm open to it.
You know, there may be another dividend as well with the vaping issue and cigarette smoking, and that is, it seems like some of the younger people who are getting severe reactions with COVID, they may have had some exposure in terms of the toxins and so on that we get. Yeah, Larry, do you have any evidence to that? No. Mike, did you have something?
I'm sorry, I had to step away. What was the question?
There's some evidence now that the younger people who have been vaping or using cigarettes may be more predisposed to some serious complications with COVID infections. I don't know if that's been actually studied, but I've been hearing some of that. Have you heard anything along those lines? Which would be another reason to look at banning the vaping.
Well, one of the things there, it's anecdotal right now. Research is looking at lung issues and lung inflammation is no benefit to you if you do get exposed to COVID. But they really haven't studied, and you also have to think about somebody that's already had scarring or other issues. But they are looking at it, yes. But it's all anecdotal right now. No real studies come out with it.
Thanks, Larry. Any other discussion? All right. Well, Bruce, this will be a new part of the Zoom as well. Should we just raise our hands in terms of voting, yay or nay? Is there an option to do online voting?
We can go to the chat and raise our hands over there.
Or if you can see everybody on the screen, I would call on them, ask for a roll call, yay or nay, is what I would suggest.
Yeah, that is
all right. Okay, all in favor, raise your hands. Any opposed?
No.
And any abstentions? All right, seeing none, the motion passes. So we'll have to put together the resolution, but thank you, Hamid, at keeping that before us.
Thank you very much.
Mike, Ed, did you have something as well?
I have two things. One, I don't know if everyone's aware of the fact that Mayor Van Dusen's son passed away. And I didn't know if it was appropriate that the board extend our condolences to Mayor Van Dusen as his family. Now back to Board of Health issues. I had an online discussion with Bill and Mr. Jones regarding an observation that I've made, and I think I've kind of been opening up Pandora's box a little bit. But I've been concerned over the course of the last few months that many bicycle riders in the village are not wearing bike helmets. And I learned that there is an ordinance that people 16 and under are required to wear bike helmets. I know that's always a big issue, how that's enforced. I'm seeing a lot of young people. I've seen young people with or without bike helmets, with their parents without bike helmets. And as you're probably all very aware, there has been accumulated evidence over many years that bike helmets do prevent and limit all head injuries to a certain degree, but most specifically severe head injuries, which and brain injuries. And I just think from a public health perspective, that I think maybe we need to consider some way of maybe re-educating the community. I know that the weather is going to start to get dismal, unfortunately, and it may decrease some of the bike riding, but certainly maybe in anticipation for next spring. I think it's a byproduct of the pandemic, because as you may know, across the nation, bike riding has increased over the last few months at a exponential rate. And the majority of bike shops were sold out of their inventory as early as April for the whole year. And a lot of it has to do with people looking for alternatives in transportation and not wanting to be in crowds and being able to maybe ride a bike a little more independently. But I think this is a dangerous behavior. I don't know if anyone else has seen it. Being so new to the board, I don't know what the proper protocol would be, but I thought possibly if we already have an ordinance in the village, and there is a state requirement too for transport, people who are bike messengers and things like that. But in Skokie and many of the other suburbs, it is 16 for the age. I personally feel that everyone should be wearing a bike helmet who rides a bicycle. There's also a collateral issue, and that bike helmets have become extraordinarily expensive. And that may be an impediment to many people when the bike helmet may cost as much as the bike. Now, as a physician, I think the brain is worth a lot more than these costs, but realistically, people may have a challenge. And so I don't know whether there's a way that we could possibly partner with the schools and, get the word out, but even maybe approach vendors to see if there's a way of procuring, ANSI, which is the certification level bike helmets for at a reduced price to help people, or possibly get vouchers that they could help get a discount at bike stores. Just a thought, and I just wanted to throw it out there, to the members of the board, and maybe you could think about it.
Heidi?
I love that suggestion. I've thought about the same thing. I have kids that, I get bike helmets for. I have not lived in this area my whole life, and one of the communities I lived in before this, I was a member of the Rotary Club, and we provided every second grader in town with a bike helmet as a service project. So I'm wondering if there is a way to partner, as you've suggested, with either a service organization or something, because it's a lot easier to receive a bike helmet than to get a coupon to get $10 off a bike helmet. You still have to go buy a bike helmet. And it was just a way of sort of seeding the population, anyway, I loved your suggestion, so count me in.
Habib?
Yes, I think it is a very wonderful idea, like Edward said, Doctor, welcome to the board. And we have an ordinance to wear the helmet and do outside. We need to send a request to the board of trustees, they may remind them, implementation is one part, and the other is like helmet price. Yes, we look into somewhere, maybe some form of grant, conjunction with the school or other committee, we can work on that. Maybe we can look into that in a different department together, and we may be able to use it. That's true. Helmets cost more money. Even sometimes on a bike, it might get cheaper. But that is the concern, and it is more important. Protection is more important than the bike and the helmet. And the head injury, once you have concussions, you are all lifelong, you're going to suffer on that. And I think this is a good issue. We should take it easy. We should do something about it and see what is our current situation is. We have this thing, but need the implementation for the time being. In the same way, also inform some committee, talk to the manager, village manager, or the mayor, or we should look into that and work on it, make life easier for the residents. So, all such things.
Mike?
I agree with everything that Ed just said, as someone who just recently bought 2 brand new bikes for my grandchildren from Al's Cycle Shop in Skokie, which is where I bought mine. The bikes were $400 each for my granddaughter and my grandson. The helmets were under $50, but those come along with it. I think maybe the village, the health department, can do a promotional campaign and possibly post something on the website citing the importance of wearing a helmet if you're on a bike. And this boils down to parental responsibility as far as I'm concerned for kids. For adults, I think they also need to be aware of this, because I go along the bike path every week and I see some people not wearing helmets.
I'm on the staff at Advocate Illinois Masonic, and a few years ago, the trauma service had a community outreach, mainly for children, not only on helmets, but the whole issue of bike safety. And it was received very well, and there was either helmets were distributed or there was a voucher that was passed out. So, Bruce, why don't we get together and see what we could do to move this forward? It sounds like some information perhaps could get out, and maybe see if the local bike shops are willing to participate in this as a promotion. So it's a great idea, Ed. Thank you for bringing it up, and I think we really need to follow through on this.
Sure, I have no problem. I think also to go along, sort of piggyback on that, I think we also would want to engage our police, because I know they, over the years, have been actively involved when that ordinance was first passed, and I apologize, I don't remember if Sue does. They may even have been active in having bicycle training classes at some of our local events, whether it was Festival of Cultures and other things. So I think they would be a good resource also, because ultimately it's, they would be having to enforce anything, but I think it would be good to engage them in that also.
May is Bicycle Safety Month, so there's some time to do something.
Yeah, we've got some lead time. Okay, thanks, Ivan. Any more discussion about this topic? Is there any other new business?
I just had a question, and I know I'm talking more than I ever have, but how can the board members be helpful to the Board of Health right now? Like, I love coming to the monthly meeting and getting an update and opining on the state of public health, but what action can we be doing that will help you?
Well, I think one thing, my neighbors know that I'm on the board, and they ask me all the time about COVID, and to direct them to the website where they can get a daily update, just as you were saying. I get that alert on my phone, and I check that within a few minutes. It's I think interesting, but it's also vital. So that could be one thing, would be just to talk with the neighbors and have them aware of that. I think we need to brainstorm. I think, though, about what we can do as a board. As our first meeting, I think it probably in this format it's a little more difficult. But if you have ideas about how the board can support the health department, why don't you send them on to Bruce and myself?
Will do.
All right. Any other comments?
Did we approve the minutes of the last board meeting? We did not. I think we.
No, actually, what we're going to do is use a consent agenda. I announced this at the beginning, that unless somebody wanted to extract an item out of the minutes, they would stand as they're published. So, is there anything you want to pull out of the minutes?
No, everything look okay, because I'm excited. We're meeting together. That's a good thing. After six months, and that's also maybe we could change the format. And look very good, and we miss everybody, and wish you all the good health. And we are here together. That's all. Dr. William keep us together.
Yes, having not seen you all in 6 months, 7 months?
Yeah.
You're the boss.
I'd like to thank all the members of the Board of Health for their support and all that we've been able to accomplish in the 20 years that I was a member of the board. I'm emeritus, so the reason I didn't vote is I don't get to vote. But particularly in the last 10 years as being chairman, I really appreciate the support and all that we were able to accomplish for the village of Skokie and for the surrounding community. So I thank you all for being with me, bearing with me during that time, and I hope to contribute by attending the meetings. And Romeo, we will eat before the next meeting that we do get together. So thank you very much for Bill for assuming the position of chairman, and I can see that the meetings are going to be well run and succinct. So for the Zoom format, I thought it was a great job today.
Doctor, can I ask you a question? Don't take it serious. Is it pre-planned? We go on board together, or there's something coincident? You and Dr. Bernard, leave us.
No, it was not. It was not planned. It just happened that way. But knowing both Bill and Bruce, I am sure that the board will not stop in doing the good work that we do. And the king is dead. Long live the king. Somebody else will come along. I know that Dr. Kennard had promised that she would stay for 5 years. And having been with us for 11 years and having worked closely with her for the 11 years that she was here, I think she did an outstanding job, and I wish her the best and that she continues to do well. The state of Illinois has made an excellent appointment, and Mike, you know that she is full speed ahead. So for us in Illinois, and she will always remember and work with the village of Skokie in regards to providing those services that make us an outstanding community.
Thank you for those words. Larry, did you want to say something?
Yeah, Heidi brought up a good point, and a couple other folks did too. More we could do for the board and the public health issues in Skokie. Many of us belong to other organizations. I belong to Chicago Dental Society. I belong to the other organizations, and I have no problems reporting what we're doing because it comes up on a regular basis. What are the communities doing? What are other people involved with? And I sort of act as a spokesperson to mention that. We just started a Master's in Public Health program at Midwestern, and we have several students that are in the dental school where I teach, and they're very interested in projects and working with public health. I'm referring them to the Skokie Public Health Department and the possibility of getting some help. And I know Catherine was doing that, Dr. Kennard was doing that with UIC. So there's a lot of cross discussion and sharing of information. And I think with her being with IDPH now, and the more that we can do, so it might be nice if our board was to send out or gather information from us of the organizations we belong to and how we're sharing information. That could actually show what a tremendous input or effect we have throughout the area. Those of us who are on school boards, those of us that are doing other things, even through churches, parochial, whatever, it could be shown to others and say, we have more outreach than we realized. It's not just word of mouth, we're actually involved. Anyway.
No, I think that's a good suggestion. Heidi suggested how we can support the board, and I recommend that you send ideas to Bruce and myself, and perhaps include in that the organizations that you're active with.
Yep.
So, Trustee Bromberg.
Hi, I just wanted to say hello and introduce myself. I'm Trustee Bromberg. I've been a trustee since '01, and I just wanted to tell the board you all are just working so hard, and I really appreciate everything you're doing for the village. And I'm excited that we get to meet again on Zoom, not in person, but at least we can meet somewhat. And I'm there to be your liaison to the village board. So if anything I could do to help you out, just let me know.
And thank you so much for attending today and participating. We really appreciate it.
Thank you. Oh, and my background is I work for the Illinois Department of Financial and Professional Regulation. I'm a nurse, and I oversee all the 130 nursing schools in the state, as well as about 240 nurses. And, we do all the licensing, testing, and discipline of the nursing license at IDFPR.
Big job, important job.
Thank you.
Any other new business? Seeing none. Bruce, did we get any citizen comments coming through?
I'm gonna go to the computer for one moment just to check and see, and I'll be right back, all right?
All right. I just have to say, I think this went better than I expected. I've been in some Zoom meetings that have not gone very well, but I want to congratulate all of you. I think we're achieving a level, at least, being tech savvy enough that we can communicate. I wish we could all be together, but it was good to see everybody here.
I think this is the COVID positive thing. COVID teachers, Zoom meeting and everything.
The only time we want to be COVID positive.
David, they're professional Zoomers.
Thank you, I appreciate it. I apologize for a little bit of hiccup with the audio there at the beginning, but I'll make sure we're totally on track next time, so I apologize. But I checked the computer, there's no citizens' comments. There was a few things in the chat which we had already addressed via Sue answering and Heidi asking the question. So I think we're all good with that portion of the agenda.
Okay.
You move to adjourn the meeting?
All right, is there a second?
Yeah.
And I'm assuming everybody is interested in leaving, so unless you object, we'll adjourn the meeting. And we did very well. It's 9 minutes after 8. So Dr. Drackler, we're sticking with your punctual format and treated us well.
Thank you.
Thank you.
Thank you all, appreciate it.
Thank you all.
Take care, Bruce.
Take care,
Bye-bye.
stay safe.
Okay.
See you all next month.
Next month.
See you next month.
Yeah.
Thank you.
And let me, one second.